healthcare field, right? So it's a diverse field, and my idea would be to use the existing healthcare infrastructure and existing telecom sector, I mean the technology, and by making them together, not to come up with any high-tech thing or something. So just to utilize those things, and which will help in better healthcare delivery. So.
Yeah. I know that you have worked in rural Pakistan, and especially in maternal and child health. In regards to the first video, the sort of commercial about why it's important to use skilled birth attendant versus like sort of normal birth attendant, and then the TBA, the traditional birth attendant, and I've done some research myself about that. So in relation with what Louis just asked you, so, and then also in relation with mobile health, what do you see, and I know there are already some challenges, but how do you see you can use mobile health to sort of bridge that gap between skilled birth attendant and traditional birth attendant? Because the fun thing is that when you do the research, so yes, people, especially in the rural areas, even if they know they can use or they need to use skilled birth attendant, but usually it doesn't translate easily. So how do you think you can use, based on your knowledge of Pakistan reality, mobile health strategy or technology to sort of bridge that gap, to connect the two worlds, and then sort of decrease the maternal mortality ratio?
But there is a culture in Pakistan that every community has community leaders, right? So first we have to contact any woman, any girl in that community, we have to go to first community leaders. We cannot go directly to them. It would be hard for everyone to go directly to them. It's just something unethical there, you can say. Not exactly in the developed countries, but if we follow their culture, their customs, it's hard to contact them directly. So community health worker, community leaders can play a better role in this scenario, and to change their minds first. So as I said before, it's something to change their perceptions, and there can be many stakeholders involved from diverse background, community leaders. If you come to the telecom sector, then people who are working in the telecom field, then people who have good positions in the healthcare field, then programmers, and then obviously patients to set their mind. And I think in this scenario, simple, if I see Pakistan, the simple mobile messages would work more than anything else, just to tell them what preventive measures they can take, rather than providing them any treatment or something. So just something, few messages to tell them that this you can do, so this will happen to you. This we can think of.
Thanks.
Yes, back to this. Now I will tell you something about the healthcare infrastructure in Pakistan. Well, presently, we do not have central regulating authority to answer the functioning of health sector at the state level. I know this will be shocking. This change took place in last year when a new health policy was drafted. Federal ministry was abolished and powers have been transferred to the provincial level. The idea was basically to provide healthcare services at the grassroots level. Like many other healthcare systems in the world, Pakistan has three-tiered healthcare delivery system: primary, secondary, and tertiary. The primary care includes basic health units and rural health centers, where community health workers are the primary care providers in the rural areas of Pakistan. They provide preventive, curative, and rehabilitative services to the community. They also educate and provide family planning methods. Then secondary care includes first and second referral facilities which provide acute, outpatient, and inpatient care through tehsil headquarters and district headquarter hospitals. These places, these hospitals facilities vary from place to place. Then tertiary care comprises of provincial health development centers, the institutes of public health and provincial health services academy. These institutions work closely together with teaching hospitals and medical colleges, as well as private sector institutions to address the gaps in the health manpower in the province. As I said, lady health workers are the main point of contact for people in rural areas. So I want to show a video made by UNICEF just to have an idea that how lady health workers work in Pakistan.
You are watching UNICEF television. It is a hot sunny day. Sakina is visiting the home of a new mother in a small village in Tata. She is one of 46,000 lady health workers that have been providing basic health care services like vaccinations to women and children. Her job is to visit homes in rural communities around the district and advise women on health, hygiene and nutrition. Since the floods, however, their jobs have become much more challenging. 1 in 4 lady health workers themselves were affected by the floods. Yet, they have advised more than 900,000 women on health and hygiene since the onslaught of the floods.
In the beginning, there were thousands of women who came from the affected areas and stayed in the camps and put up tents on the side of the roads. Because of the summer heat, there was a threat of a measles epidemic. So, we went to the campaign to vaccinate all the children under 5.
In Jamshoro, Dr. Sajda, who is in charge of the lady health workers for her district, has had her team working round the clock since the floods. Just in this camp, there were over 50,000 people. But due to the extensive immunization intervention, we did not have any major outbreaks of even diarrhea. There have been no deaths, because these girls conducted extensive health education sessions and had distributed oral rehydration salts. Prevention of disease and epidemics would not have been possible without the devotion of these women.
Before, most of the women were having 1 child every year. So, we also motivated them towards family planning and referred them to the hospitals for contraceptive surgeries. Now, they themselves want to get operations done to prevent further pregnancies.
35-year-old Razia is a mother of 7 children. She is due for surgery next week. In the village, we were living like savages. Our children are always sick, and because we are poor, we cannot afford proper treatment. I don't want to have any more children. I just want to be able to feed the ones I have and keep them healthy. I can sew. If only I could get a sewing machine, maybe I will be able to provide for my family. Though the flood waters have receded, awareness on how to raise healthy children is still a huge need. As the temperatures increase, the UNICEF-supported Lady Health Worker program is playing a critical role in preventing and reducing disease in young children. This is Natasha D'Souza reporting from Tata, Sindh. For more information, go to unicef.org. Unite for Children.
So it said there are 46,000?
Yes, but they're all by themselves. I mean, the problem is to provide training to them.
Mm-hmm.
They're not well trained there.
And do they use mobile phones now in any way that supports them in the field? Or do they use any resources that help them deliver information?
The only field is in its initial stage right now. We are like the project which I worked with, Jiroka Healthcare Project, they try to introduce mobile phones there, not specifically regular treatment at the first stage to the underserved community. So this overview of healthcare in Pakistan, now I would like to tell something about how mobile technology can benefit the healthcare field. Mobile phones are fast becoming a convenient modality to deliver healthcare services in underdeveloped and underserved areas of Pakistan. And according to BMI mobile, the percentage of mobile users will reach approximately 96% by 2030. And in Pakistan, basically you will find mobile phones in the hands of illiterate people as well. There are places in Pakistan where there is shortage of homes, water, food, but they must be using mobile phones. So it has also been seen when any disaster comes, people take away 4 things: their ID card. They take these 4 things while leaving their houses: right? Their ID card, money, animals, which if they have, then mobile phones. So nowadays it's part of like basic necessity in rural areas of Pakistan. Combining mobile technologies with existing resources in the healthcare system offers a great potential to provide comprehensive care to women and newborns that stimulate demand for available resources, promote improved access, and lead to efficiencies in care delivery and management practices. So ML applications are not for patients only, right? If you can see the services. It also helps doctors or the healthcare providers. And obviously not to forget the health system. It is not a separate field, but these applications can easily be integrated into the WHO continuum of care. I will not go in much detail because we don't have much time, but I will tell you that because as one stage of pregnancy leads to another stage, ML facilitates the whole continuum of care. Then ML solutions can address family planning, antenatal care, diagnostic and treatment support, administration and training, supply chain management, and finance and payments. I want to quote this example here. This is interactive alerts for childhood pneumonia. This is the project, which is helping doctors to track and treat the incidence of pneumonia in their patients by scanning RFID tags on infants' bracelets. The program is a collaborative effort launched by the Interactive Research and Development, a Karachi-based non-profit company, Karachi's Indus Hospital, and the Johns Hopkins Bloomberg School of Public Health, Department of International Health. And this program is being funded by the International Non-Profit Program for Appropriate International Non-Profit Program for Appropriate Technologies in Health, that is PATH. And they have the grant from Bill and Melinda Gates Foundation. To understand this program better, I'll show you one video.
Is this national or?